national recruiter for the American Canadian School of Medicine, ACSOM. On behalf of our dedicated faculty and the entire ACSOM team, I want to welcome you this evening. And I also want to invite you to let us know, drop it in the chat, where in the world you are. Let us know what city, what state. I myself am in Chicago, the beautiful city of Chicago. So let us know where you are. In addition to that, also let us know along the way any questions you have at any point. We will address them during the webinar or at the end when we have our questions and answers section. So my name again is Maria. This is my telephone number and my email address. I welcome you to either directly text me, call me, email me. I'm always available to answer any questions you have. Today, I'm very excited to introduce our esteemed president, Carrie M. James. Mr. James is a driving force behind ACSOM, infusing our institution with a remarkable blend of experience and passion. Please join me in giving a warm welcome to Mr. Carrie M. James.
Thank you, Maria. It's my pleasure to join you and the team today as we talk to people about our medical school and what makes it special. I know today we're going to delve into some of the technology that we use on campus to support student learning. We try and be very innovative. In fact, I think just even how we were founded was an innovation. We are a private, nonprofit medical school in the Caribbean, and we operate in partnership with the government of the Commonwealth of Dominica. We have a state-of-the-art $100 million, 30-acre campus that is provided by the government of Dominica. And where ACSOM comes in is they were really looking for experts in medical education that could create a new school with the highest accreditations, with the best training to be technologically forward. And beyond our mission of educating great new physicians, our social mission is to improve healthcare in Dominica. And actually today is a very special day in that our faculty just received their medical licenses today in Dominica. And so I think that's a very important distinction between us and maybe what's typical for medical schools internationally, but we teach exclusively using practicing physicians, all right? Very different than what you experience in undergraduate. We train our doctors to work in groups of 10. So we have a large campus, over 160,000 square feet of purpose-built infrastructure there for medical education. But beyond the physical resources there on campus and the technological resources, again, I think it's our people resources. It's the faculty that love being physicians, that have been there making life and death decisions with their patients, managing their care of the long term. That really, their other passion is in teaching. And we make all of your academic content available on your computer from the very first day of school. Everything you need to make it through medical school is right there. You have access to it through our learning management system. You'll learn about all the different content systems that we use. And these are all supplements to our student learning. Your morning is going to be spent with expert physicians. We have 32 physicians actually that fly in from the United States and Canada. These are experts. If you look at their typical institutions, many are from Yale, Penn State, Wisconsin, MD Anderson, University of Western Ontario. These are really dignitaries within the field. And they'll have a focusing lecture maybe for an hour or over the course, or several of these lectures over the course of a week at the start of a module, focusing lectures, but really they're there to prime discussion. Really what your morning looks like is sitting down in your learning team of 10, working through clinical problems, cases with your primary professor, your physician. That's just a part of your learning team. In the afternoons, you're seeing patients, standardized patients that are coming into our labs. You're working with robotic simulators. You'll be working with medical imaging, especially in the anatomy lab, as you learn really anatomy from a surgeon's eye. It's clinically relevant. It's not just rote memorization, but you have to make clinical use of what you're learning. So it's really a special campus. It's a special learning environment. And, we're going to treat you really with the best care. You are physicians in training when you come onto our campus, and you'll be learning from physicians day in and day out. We're not going to read slides to our students. You're going to be there using the information that you've been studying in context with physicians, with your peers all day, every day. And I think it's a very exciting environment. Beyond the academics, again, you're going to be involved in the social mission of improving healthcare in Dominica. We actually participate in a number of health fairs throughout Dominica, screening for diabetes, hypertensive disorder. We're developing our community medicine module now, which our third semester students are undertaking over the next couple semesters. We've made, I think, great headway into developing collaborations with the Kalinago people of Dominica. Dominica is one of the last communities, has one of the last communities of indigenous people in the Caribbean. And we're certainly a eager participant in supporting good health care and health outcomes there. So Maria, you can go on to the next slide. So why are you on this webinar? You're either a prospective student and a student who's starting with us in August who's just excited and wants to hear more about the school, or you might be a parent or a loved one that's helping guide somebody really through their process of earning their MD. I can tell you that in North America, the majority of people that apply to medical school are qualified. If you look at those taking the MCAT, it's actually almost 75%, or the top 75% of those taking the MCAT. If you look at the AAMC data, they have a 95% chance of graduating from a medical school in the United States. So overwhelmingly, the vast majority of the people that even take the MCAT are qualified to go to medical school. Unfortunately, even with the dozens of new medical schools that have been built over the last 20 years and the expansion of the classes of existing medical students, there simply are not enough seats for all the qualified students. There just aren't. And when you start taking into account career changers, we have nurses enrolled, we have pharmacists, physician's assistant. When you look at the people that are leaving other, health professions because they want to earn their MD, they want to be the leader of that healthcare team in the hospital, even with a decade of experience, it seems to work against some students, brilliant students, and you just don't understand how they aren't being accepted within the U.S. system. And the reality is that they either have to give up on their dream or they need to find a high quality alternative. And about 20% of the practicing physicians in the United States actually have trained in the Caribbean. And if you look at international physicians overall, it's about 25%. And so I think what happens is in the US and in Canada, students have realized, well, there's another way to do this. Everybody wants to go to school at home, but what's the next best choice here? And we don't think you should compromise on your academic ideals. We don't think you should be giving up on an education with an institution that's nonprofit, that works in cooperation with the Ministry of Health, that has a social mission for the betterment of healthcare in its host nation. We don't think you should have to give up on any of that. And if you look at how we've designed our school, we've clearly considered those aspects. So it's 2 years on campus in Dominica. It's 2 years then in the United States for clinical training, and then you'll graduate. You have to take USMLE Step 1 at the end of your second year, and you have to take USMLE Step 2 before you graduate. But you pass those first two licensing exams, you complete our coursework for 2 years, our clinical clerkships for 2 years. You've completed the 4 years of our MD program, and you are then expected to apply for residency training in either the United States, Canada, or both. I should note that we have full 5-year accreditation from an internationally recognized accreditor. That means that we have ECFMG sponsor notes. That's the Educational Commission for Foreign Medical Graduates in the United States. What does that mean? That means that our students can sit and take the U.S. licensing exams. That means that our students can participate in the National Residency Match Program, or NRMP. It means they can participate in CARMS. It means they can sit the Canadian licensing exams. So if you're one of these students that just doesn't have a seat, but you're a qualified individual, a qualified student who needs a quality opportunity to go to medical school, we think you should be considering us. Do you want to go to the next slide, Maria? Thank you. One of our panelists that you'll meet today is Dr. Stanley White. He's our Senior Associate Dean for Student Affairs and also Campus Dean as well. Very experienced. He's run tutoring programs before at medical schools. He's been the Campus Dean at large medical schools before. He's been the Dean of Medical Schools before. And prior to all this, he was actually really was involved in kidney research as kidney physiologist with years of teaching and research in the United Kingdom and also in the United States at Yale. But really very lucky to have Dr. White. He's also very interested in academic technology, and so been out to Cupertino a number of times to meet with Apple and help really provide us with ideas behind not what we should just be doing now, but what's next. So, Dr. White, do you want to say any words?
Thank you, Kerry, for that glowing introduction. Good evening, everyone. It's a great pleasure and a privilege to be on this call tonight. As Kerry said, I have quite a lot of experience, both as a basic science researcher, but more importantly now as an educator and educational administrator in medical schools in the UK, the US, and the Caribbean. So, as Mr. James said, I'm the Senior Associate Dean for Student Affairs. That part of my role is I really have responsibility for monitoring and overseeing the academic progress that you all will make as you progress through our first 2 years of the basic science program. And I'm also the campus dean, so that in the physical absence of our chief academic officer and dean, Dr. Amadi, I'm responsible for the academic operations on campus, as well as the day-to-day running of some of the operational facilities on campus. So people complain to me about not having enough litter bins or not sufficient numbers of cans of Coke in the vending machines and things like that. So it's quite a broad mixture. The other part of the Dean of Student Affairs role is professional development. So I, in collaboration with the Student Governance Association, am responsible for helping build some of the professionally orientated special interest groups, like internal medicine or emergency medicine and things like that. And I work very closely in collaboration with student services, who many of you will be interfacing with now if you're preparing to come to campus or you are in the process of applying. So Maria, if you could just move on from something more interesting. Than me. So as Kerry said, we have a unique mission and vision to medical education. We've really moved away from the sorts of teaching that you may be used to in undergrad, and you may observe at a number of other schools, both in the US and the Caribbean. We don't do a lot of large class size didactic content delivery. Most of our teaching is done in a small class through two types of faculty. As Mr. James said, we have a large number of American and Canadian adjunct faculty who visit the island for periods of up to 1 to 2 weeks. They give these sort of focus lectures in the mornings, and then you will break up into small classes, which are supervised by our permanent campus faculty, who again are all MDs, many have done residencies, and are completely dedicated to your academic success within our curriculum. And the curriculum has been designed by physicians to produce successful physicians. And the approach is a flipped one, which means that instead of sitting listening to lots of lectures, you have time in advance of the academic sessions to assimilate factual information, which is given to you through several different types of learning platforms, which I know Dr. Abiola will say more about. But we use platforms like Lecturio, TrueLearn, Ambos, UWorld, And these are learning platforms within themselves, which can be programmed to support you in your studies. You, by using that factual information, come to the small class groups and work through the clinically orientated problems which our faculty have been specially trained to facilitate you in. When you're not in the classroom, as Mr. James said, you will have the opportunity to engage with our social mission, which is to engage with local health team partners, to hold various events within the outside community, more often than not at the Portsmouth market, which means that if you're involved, you can take time to go and do some vegetable shopping in between talking to local community members about their health, taking health information, giving them health education information, and doing a variety of very simple basic health screens like blood pressure, blood glucose, etc. And this is part of our broader mission, which is to engage with the Dominican government in a partnership to make a positive impact on healthcare in Dominica. Very importantly, for your considerations, if you're thinking about applying, we are fully accredited. We're fully accredited for 5 years by the Independent Agency for Accreditation and Rating, which is IAAR, and we are preliminarily accredited by the ACCM, the Accreditation Commission on Colleges of Medicine. It's very important to understand that both of those regulatory bodies are recognized by the World Federation of Medical Education. So if you go to the World Directory of Medical Schools and search for us, you'll see our entry there as a fully functional medical school. But just as importantly, you will also see that we have a sponsor note from the ECFMG, which, as Mr. James says, means that our students are qualified and eligible to take the USMLE STEP exams, as well as when they graduate, interact with the NRMP and CALMS for residency matching. So have a look at that information. And on top of all of that, we are doing our mission, and we're hoping you'll join us in that mission in probably one of the most beautiful locations on Earth. Dominica is a small island with a population of about 70,000 people. It's incredibly peaceful and tranquil, and is a wonderful environment, not only to study, but also if you're interested in things like hiking in a rainforest, or river tubing, or scuba diving, whale watching. Dominica is constantly rated within the top 4 or 5 locations in the world for those sorts of activities. The people are warm, friendly, and it's a very law-abiding island, which, as Mr. James says, includes one of the few remaining populations of indigenous Amerindians in the Caribbean. So it's just a wonderful place to be. I can tell you it's been my home for the last 14 years, and I have not regretted for a second coming to this island to work. So let's get on to the main part of the evening, and that is a presentation by Dr. Abiola Omadan. He is the director of our anatomy course. He's also the acting associate dean for admissions at the moment. He has a very rich experience, having qualified originally in Lagos, Nigeria. He also holds a PhD, and he also is interested in educational technology as it applies to anatomy. So without further ado, I would welcome Dr. Abiola Omadan, and I'm looking forward to hearing what you've got to say.
Hello, everyone. Thank you so much, Dr. White. Just as it's been announced, I am Abiola Omadan, and I am so very much happy and privileged to join you in this webinar today. So today, the main focus of our topic today is going to be on the cutting edge technology in medical training. Just as every one of us is going to agree, training doctors these days has evolved over time. And so in catching up with the advent of technology, the education of doctors that are going to take care of the ever complex world of diseases need to be augmented with technology as well. So that at some point opened up a whole lot of interactions between doctors and IT specialists in developing a whole lot of technology so that we can be abreast of the ever-changing field of disease fighting. Now, realizing that fact, American Canadian School of Medicine obviously has shown its commitment in making sure that the students are not left behind in being exposed to this technology that is available outside there to teach medical students. So today I'm just going to be going over a few of those technology that we have available with us here. And one of the most interesting ones that we actually make use of in the anatomy department is a software known as Complete Anatomy. So this app was actually developed by a surgeon in the US, and it has been proven to be of high quality to the education of medical students. It's highly very interesting because it comes in very interactive 3D models, and this alone excites students, and it's actually like the base work of the ground to be covered in the field of anatomy. So one of the things that this app does, amongst other things, is that it actually stimulates the knowledge in these students. So these days, we know that almost everybody has some form of interaction with technology. Everybody has a cell phone. And on everybody's cell phone, these days, we do just more than receiving calls and sending text messages. There are several games and there are several things. So the application of this software platform actually, it's something that the new generation medical student actually can relate to it. So it's just like an elongation of their interactions with the phone. So it makes sure that it creates a room for excitement in learning anatomy. Next slide, please. Okay. So, by the side, aside these technological innovations that have been introduced into the learning of anatomy, one of the other things that we focus on is your clinical skills training. We understand the fact that one thing is for you to learn the theoretical aspect, but then again, you must be proficient in your clinical training as well. Therefore, we have actually introduced some technology state of art in your learning of clinical skills. Some of them include Harvey, the popular Harvey. I'm sure you should have heard of Harvey before. It's actually a cardiopulmonary mannequin that actually stimulates any cardiac disease that you have at the touch of a button. So if you want to stimulate heart failure, if you want to stimulate any form of cardiac disease, Harvey is right there. And then that's one of the things that we use to teach the medical students out here in our clinical skill departments. Aside Harvey, we have another type of mannequin called the Sim Man 3G. So what this machine actually, this machine mannequin does is that it helps you in learning what we call advanced life skills, as well as the advanced cardiac life skills. So these are skills that you would need in your journey in the medical profession. So these days, most schools would actually wait a while before you get exposed to this kind of skills, but we understand the fact that these are skills that you need to start picking up along the way, right from the very beginning. So we've got these mannequins as well that are there to help you learn the skills right from the very beginning. So one other thing that we are proud of that we do in the anatomy department is that as part of our learning skills, we actually expose you straight to by the bedside and diagnosis using ultrasound machines. And so one of the things that we have is the latest butterfly ultrasonography machine that you can actually use at the bedside to diagnose a patient right there. So that's one of the technology that we have actually included in our anatomy department. Okay, so how has the experience been, and what actually do I think benefits students most about this experience? I'll give you a very simple example. So aside that software, the complete anatomy software that I told you about, our main dissection platform these days has actually evolved away from the cadaveric dissections that you might actually have learnt about in medical schools. A whole number of top medical schools world over are actually moving away from cadaveric dissections into what we call virtual reality dissections. And we have the top of the art machines that are going to help you in virtual reality dissections. So how do we do this, or how do we go about this? Our students have Oculus headsets that actually are equipped with the latest dissection softwares, and the students are immersed in that experience themselves. So they find themselves dissecting virtually. And what are the advantages of this dissection virtually? Obviously, the very first one is, if you have ever had any experience medically in the hospitals, clinics, or even in the medical school, one of the things that we run away from most is the stench of formalin that are being used to preserve all these cadavers. So the first thing that is taken away by the use of these VR sets is that you do not have to trouble yourself about how you're going to breathe in a cadaveric environment that has been preserved using formalin. That's one. Number two is that when you're dissecting using the cadaver, at best you can have 5 students to a body. And at any point in time, it's only one student that holds a scalpel. That's the blade. So if, for instance, you tell the student, oh, I want you to expose the phrenic nerve, and obviously because of naivety, or this is a fresh student and mistakenly cuts the phrenic nerve, every other remaining students, the 4 remaining students, have been disadvantaged. So the best that they can get out of it is the teacher just trying to show them putting the cut ends together and say, oh, this is what the phrenic nerve is supposed to look like. However, what virtual reality dissection has actually introduced is that when you mistakenly dissect off the phrenic nerve, all you need to do is just press the reset button or undo button, and then it goes back to what it's normally supposed to be. So everybody has the same baseline. Nobody is disadvantaged. And the most interesting aspect of it that I enjoy most is actually how the students are engaged. Almost everybody these days, like I mentioned earlier on, is exposed to technological games. We like to play games in reality spaces and thereabouts. So the students find it very exciting to put on these goggle headsets and dissect. So anatomy has moved from that, what we used to know back then as one very boring and very scary area of medicine, to this very interesting, enthusiastic area that people always look forward to. And what does it do? Obviously, it improves the learning. It improves the mastery of the anatomy. Invariably, obviously, if your anatomy is improved, your surgical skills are improved, your medical skills are improved, your gynecological skills are improved. And that is actually the effect that we are seeing with the introduction of these new technological tools in the world of medicine. And we are not left behind. We have everything right here for you to immerse yourself in your studies. Next, please. Okay. Well, I'll quickly mention a little bit about the flipped classroom experience. So Dr. White earlier on told you what the flip idea is all about. So the flip idea actually is, or originates from the idea that, look, these days, all the information you need as a person is out there in the space. The role of a teacher these days is actually more on how to direct you and guide you to the right information that is out there. So the flipped classroom comes from that belief that, look, before the class, you get the material that is supposed to be studied. And at your time in your hostel, in your house, you go through the material and you study it. So you come back to class, and that classroom time is used for other things. So what are those other things that the classroom time is used for? So it is now used to solve clinical problems that are related to what you have learned probably the day before or the week before. So you don't spend time listening to a teacher reeling out slides to you or telling you what to do. You have known precisely what the content is, and you come to class. In our own case, you come to class and you do what? We now give you clinical scenarios that are applicable to what you have learned. And so in your group, your small group, where you are like 5 or you're like 8 or 10, you pace order up and then you discuss. Oh, for instance, if you found a patient that has so and so symptoms, how are you going to approach it? What is going to be your management line? How are you going to outline this? So that is exactly what we do here with our flipped classroom. So you have all the materials to go back to. You have Lecturio, you have TrueLearn, you have Amboss, you have UWorld, you have Complete Anatomy, you have all the materials that you need to get the knowledge that you need for the session. And you have gotten most of the knowledge day before the session. What the teacher does is he stands there to guide you in your path to arriving at the right decision or at the right time. So what advantages does this have? Obviously, the first one is that first and foremost, there is a great atmosphere in the class. Everybody seems to talk because everybody must have an idea. That is the role of the teacher in front of you. So it makes sure that it gets everybody's opinion. So everybody interacts. There's a liveliness in that class. And obviously, because you've read this before, you have one or two things to say. But if you haven't, obviously your own area is going to show. So nobody wants to come to class embarrassed. So everybody has gone through the material. And so everybody contributes. And there's a greater understanding of the material because you are going to go at your pace. If you were in the normal didactic era learning style, whereby the teacher reels out things from the slides to you, the teacher might be going at a faster pace than you. But then you have the material, you can go home at your own pace and read it. So there's a better understanding of the material. You are able to assimilate at your own speed. Nobody is pushing you. Nobody is forcing you. So that is the experience that we are giving our students. You don't find yourself in a classroom of 200 or even 50 students and the slide is being moved from one to the other in like 1 minute or 2 minutes. No, you don't do that. You are involved one-on-one. Another advantage of this is that the teacher, that your faculty, picks out the weak links right from the beginning. So we don't wait until it's like 2 weeks to your USMLE step 1 exam before we find out, oh, this patient, this candidate or this student is a weak student. No, right from beginning, everybody stands out because there's an interaction with the faculty right in front of you. It's just in charge of 5 of you or at most 8 of you. And so it sees the weak points of everyone right from the beginning. And then he's able to address you one-on-one and help you out in your weak areas. So that is the experience that we try to dish out as regarding the flipped classroom on our campus. Okay, so Dr. White mentioned a little bit earlier on our curriculum. So our curriculum is actually rigorously designed for this current generation of doctors. So a few other Ivy League schools, of course, have actually started implementing this same curriculum. So one of the things that we do is that the teaching is such that it's mapped out in a systemic way, such that once you are dealing, for instance, with cardiovascular system, then you must look at the pharmacology of cardiovascular system. So it's at that point you're looking at the medications that you need to take in for cardiovascular diseases. It's at that point you look at the anatomy of the cardiovascular system. You look at the physiology of the cardiovascular system, the biochemical things that go on in the cardiovascular system. So that's one design that our curriculum has. So we go systemically. We don't go, for instance, they are teaching cardiovascular system in physiology, you in anatomy, you are doing head and neck and thereabouts. No. So that's one advantage of the design of our curriculum. And it is so packed in such a way that no area that you need to learn is left behind. However, what this does or what this demands from you is your dedication and your willingness to put in your own part, because medical school, obviously, it's a great place to be, but it is at times not a walk in the park. But then you would never feel alone. You would never walk alone because you've got all the support that you have around you to help you navigate this very challenging period of your life. And it helps you to be this person that can independently solve problems. You can sit down and think about ways to solve things without you panicking and shouting and calling for help. Although it's good to call for help when you're actually lost, but then this curriculum is going to enable you to be independent and strong and a doctor that can be relied upon by any patient. Okay, well, I think this session will be best handled by Maria, right?
Correct. Yes, thank you so much, Dr. Abiola Madan, for all of that great insight and information. We appreciate having you today. Please stay a little bit longer. We're going to have our Q&A session in a little bit, but I do want to go ahead and review the admissions process and our criteria now that we have learned so much about the cutting edge technology that we use at ACSOM and why ACSOM is the right choice for you. Let's talk about how you can apply. So these are the basic criteria necessary in order to submit an application. I did see in the chat that somebody just went ahead and applied recently, so that's fantastic. Congratulations. I will be reaching out to you shortly to congratulate you personally. And I do also see a lot of questions coming in, so that's fabulous. I know we're answering some of them as we go along, but again, we will have a Q&A section in a little bit, so please keep those questions coming. No question is, unnecessary or silly or anything like that. Please send us all the questions you have or any areas that you want to learn more about. Okay, so admissions. So in order to apply to the MD program, you do need a bachelor's degree or higher. If you're in another country, Canada or Britain, for example, it will be something equivalent to our bachelor's degree. If it is an international degree, then we suggest getting an equivalent assessment of it by a company like WES, for example. They basically let us know regarding your transcripts if it is equivalent to what we would have here in the United States. So as far as actual course requirements, we do require 2 semesters of biology, 2 semesters of chemistry, 1 additional semester of organic chemistry, and 1 semester of math or biostatistics, as well as a semester of physics. So if you don't have specific courses that fall into these titles or these names, we will evaluate your transcripts and determine if a class is equivalent to one of the ones that we require. So don't fret if you don't have a class, that's exactly called, biostatistics or physics. Again, there might be something in your transcripts that we can accept in lieu of one of these. In addition to that, you also need to submit all of your transcripts to any and all schools you have attended. So please make sure that you submit those. They can be unofficial initially. Once we start the process going and, once you're accepted, we're assuming the best here, but once you are accepted, down the line, we will require the official transcripts. But initially, just for you to apply tonight, for example, you just need your unofficial transcripts. In addition to that, you do need 2 letters of recommendation, preferably regarding your academic performance, obviously. So professors, if you're currently in school, make sure you're developing these connections with your professors so that when the time comes, you can request a letter of recommendation from them. So please have 2 letters available for us. Again, you don't need them immediately at the time that you apply, but you will need them down the line. So initially the process is for us to evaluate your transcripts. And while that's being done, you can work on those letters of recommendation. Now, importantly also is your personal statement. This is an opportunity for you to tell us about yourself, about your journey, what motivates you. Let us know whatever you think is important for the admissions committee to know. So this is your opportunity to present yourself in the best possible light or explain something. For example, if you had a difficult first semester in college, let us know. Explain what happened so that we, have an idea of your academic performance and who you are and, what brought you to this point. Maybe, somebody in your family had an illness and that inspired you to learn about medicine. And that's why you're here today applying to ACSOM. But we want to know these things. We want to know what motivates you. So, personal statement, important. It does not have to be long at all, though. It has to be concise. We also need your resume, so make sure that you send us your current resume. Even if you have not worked, have you shadowed, have you volunteered, anything like that, have you had internships? You can put any of those experiences in your resume. So please don't fret if you don't have an actual job or you haven't had the time, because we're assuming you have been busy in your academics. So that's perfectly understandable. Now, the MCAT, that is an exam that, nobody is super excited to take. Obviously, it's very challenging, very difficult. If you have taken it, we will require that MCAT score. Now, if you have taken it once or several times and your score isn't what it needs to be, what you would like for it to be to make you competitive, we do have a prep program, Prep for Success, that allows you to take a course, a semester, I should say, on our campus at a decelerated rate. So it is 19 weeks. It is 12 weeks. Basically, it's a prep program that gives you the necessary foundation to successfully start the MD program without your MCAT. Or again, if your MCAT score is lower than you need it, or we would prefer it to be. So, if the MCAT is a challenge, that may be something we can work with. So please don't feel completely discouraged if your MCAT score isn't what it needs to be. Again, as long as you have the necessary foundation, then we feel comfortable that you will successfully complete the program. All right. And then finally, you do have an interview with the admissions committee. This, basically is something that is difficult to prepare for. So my suggestions always are to control what you can control, right? Make sure that you're early. Definitely on time. Make sure that you are in a space that is quiet, where you're able to focus, answer your questions. If you have questions of your own, which is always suggested, we want you to be in a situation where you're not distracted. So dress professionally. It's basically an interview. It's, again, another opportunity to present yourself in the best possible light so that you can advocate for yourself and make a case for why you are an appropriate candidate for ACSOM. So that is an important process. Now, if you have the AMCAS, ACOMAS, or a variety of other applications, you can submit them, and you do not need to submit the transcripts, for example, or the MCAT scores individually. It's all, compiled together in those applications. So if you just want to submit one of those, go ahead and do that. And again, you do not have to submit the different components individually. Okay, so let's move on. I do want to say, again, congratulations to those that have already applied. I know there are a few here. And if you are on the point of applying, you have questions, you're just not sure, please do not hesitate to reach out to myself. I'm always here to answer any questions you have. If you are ready, however, please use your phone right now, grab this QR code. It's going to take you directly to the application. Don't apply right now because we want to make sure that you're present with us in the webinar. But as soon as the webinar is over, make sure to complete that application. There is no fee for the application. So complete it today. Again, you don't have to have your official transcripts. You don't have to have your letters of recommendation right now. But let's start the process. And we do have the semester beginning in August, which is next week. But believe it or not, if you are serious and you are committed and logistically it's possible for you to get to the island of Dominica and get started, we will be able to expedite your application. You need to submit it tonight or tomorrow. But, once we receive your application, again, we'll be able to expedite it and determine if you are, in fact, a good candidate for our program, whether it's the prep program or the MD program. We can make it happen. So it's obviously important for you to take that first step and submit that application. If you're not ready for August, you can submit the application tonight and we can look at it for January. So, it's a rolling admission. Okay, so I want to open up the floor. Again, I know I see lots of questions, so I want to go ahead and address those at this point. If I can invite the rest of the panel as well to be available as we address these questions. Thank you. Hello, everybody. Welcome back. All right, so let's start with some questions. I know there was a question about MCAT. I think we addressed that. Somebody put in, yeah, okay, so that one's been addressed. Thank you for submitting that. Again, if you have taken the MCAT and your score isn't what you want it to be, we do have a possible alternative for you if you qualify, and that's the prep program. So for which you do not need the MCAT. Okay, let's go with other questions. There was a question about cadavers. Dr. Stanley White answered that. Do you want to go into a little bit more detail for the rest of us, Dr. White, on the use or not the use of cadavers?
Well, I think Dr. Omadan covered it very clearly. You know, there has been a drift away from the use of human cadavers in medical education for the reasons that Dr. Omadan explained, particularly the ability to reuse a cadaveric approach digitally, which wouldn't be possible using a real body. For me, I've never been a fan of cadaveric dissection. I think it's very limited in its educational value. Other people disagree with that. But I think, you know, our adoption of the complete anatomy program, which actually I was responsible for introducing at another medical school in the Caribbean previous to here, I think is putting us ahead of the curve on anatomical education, particularly in combination with the ultrasound capabilities that Dr. Ramadan supervises so well in the lab.
All right.
I was just going to add, you know, I usually sit in on Dr. King's, program, I guess, or sessions with our students in the anatomy lab when he flies in from Wisconsin. He comes to campus about 6 different weeks a year, 3 times each semester. And depending on what the students are studying at the time of the module that they're in, different surgeries that he displays. And about 90% of his surgeries are robotic. And what's interesting about Dr. King is he started off as a classical anatomist, earned a PhD at Boston University School of Medicine, and later went on to earn his MD, trained as a general surgeon, and then did a fellowship for colorectal surgery. He's won a number of teaching awards at several schools now at this point, at each place, at each stop, I guess. And but seeing him take our students through one of his typical surgeries and quizzing them really on their understanding of the anatomy, and taking them through the progression of one of their surgeries and asking about the consequence if he removes one piece of anatomy or another. What are things he can build or otherwise create to compensate for some of those losses? But he's going through, and I think our students can see just the everyday concerns of a surgeon as they're going through any number of different surgeries. Some of the surprises that you find when you're there that maybe look a little bit different from your imaging, and just the problem solving that a surgeon has to deal with. But at the root of all of it, it's the anatomy and physiology of the human body and what he's trying to correct for. And it's pretty amazing to see our students using their anatomical knowledge in context, not in a rote memorization way or going through a roadmap of the human body, but having a reasonable discussion with the surgeon about what happened just last month in the hospital. So it's really pretty amazing, and it's even for a layperson such as myself, it's really just I think anybody can sit in on these sessions and gains an appreciation for what our students are doing.
All right. We also had a question from David. Maybe Dr. Ramadan, you can answer this one. David wanted to know if there's a preference between Apple Computer or Windows. Is there an advantage to one or the other?
Oh, yeah. Well, so, yeah, I think there is these days a preference, I guess, for Apple products and Apple. And I think Dr. White actually should be in a better position, because these days I think we are moving to the status of Apple compliant campus. And I think there's a program like that we're working towards, right?
Yeah, I actually answered it in the chat saying no. It's actually an advantage to be Apple and iOS. That's based on my own experience. I haven't used Windows since 1997, and I've never regretted it. But much of the interactive teaching in the small group sessions involves the students using their iPads. Everything we do is compatible with pretty much everything we do is compatible with Android or Windows as well. But one of our goals is to become an Apple distinguished school, and that requires us to make significant investment in the iOS ecosystem. So, I don't think it's really dreadful if you come along with a Windows computer. We'll treat you with sympathy and delicacy, but it really, I don't know why anybody uses Windows. Anyway, that's my personal prejudice based on years of experience.
Great, thank you. All right, we had a question also from Genesis Knight. She wants to know what are some on-site opportunities that are offered. She said by companies, but I'm thinking maybe clinics or a medical setting for hands-on experience for our students.
Yeah, I wasn't sure about that question. I saw it in the because I think she used the term internships. But as we roll out our community medicine program, more and more opportunities for working within the local clinical settings should become available for all students, and that includes the main teaching hospital on the island in Roseau, as well as the second hospital on the northeast side of the island, and various health centers in the local Portsmouth area as well.
Okay, great. And we also had a question about tuition. Carrie, do you want to talk to us a little bit about maybe scholarship opportunities?
Yeah, and so I can say that to this point, 100% of our students have received some form of financial aid. That can be grants, scholarships, loans. We do have our own loan program that are adding additional options as well. For Canadian students, there's several banks in Canada that work with our students on professional lines of credit. In terms of so tuition, if you added up all 4 years, you don't have these heavy fees. I think there may be a fee for student government that's nominal, but it's we just put it all into the tuition price. Sometimes schools will have $10,000 of fees that they kind of hide outside of their tuition. We don't play those kinds of games. We just put it into our tuition for all 4 years is $214,000. It's $50,000 per year, or $25,000 per semester during your foundations of medicine. It's $57,000 per year, or $23,500 per semester during your clinical years in the United States, which are the last 2 years. The typical in-state tuition in the United States now, or the average one, is in the $235,000 range. And then if you look at private schools in the U.S., that average tuition is now over $300,000. You'll see schools in the Caribbean that put hundreds of students into a classroom that charge something like $350,000 or $300,000 for tuition. Frankly, they should be charging less, not more. But again, I think the difference between us and maybe regionally, you do see there's one other nonprofit school in the Caribbean, that's the University of West Indies, which is a public institution really formed to train physicians for the West Indies, right, and for the healthcare systems throughout the nations here. And but we're the only private nonprofit school, and we put our tuition towards education. It doesn't have to go towards profit or other things or anything other than education, and making sure that we operate the campus and take care of our students and so on. But we're the fact that we're actually slightly less than the typical in-state tuition in the U.S. we're very proud of. If you look at how we're teaching, one physician with no more than 10 students, as Dr. Abiola mentioned, it's more like 4 or 5 students and a physician in most of our learning teams. I'd challenge you to find U.S. medical schools that commit that many resources to the day-to-day, educational input with their students. Certainly, U.S. med schools have huge research budgets and tremendous clinical facilities and so on. We train in U.S. clinical facilities for years 3 and 4. We're lucky to, and proud to have access to them. But it's there's not too many schools that will take a practicing physician out of the hospital, train them for half a year, which is what we do. We put our faculty through the Johns Hopkins curriculum development course. We put them through the Stanford faculty development course. That's taught by Dr. Jeff Wong, who's I think he just retired, but he was the Associate Dean for Education at Penn State. So we have experts teaching our experts, our faculty, really just excellence in small group teaching. So before any faculty member teaches our students, they've been in training for at least 6, if not 9 months, specifically around small group teaching. Doesn't matter that they've been practicing and making life and death decisions and training residents and training medical students in the hospitals. They're experienced, but we start from the ground up, making sure that our students, our faculty, are able to teach our curriculum. So it's a long answer to a short question, but I'm proud of the extraordinary academic resources, right? Leading with the people resources, leading with our physician faculty that we make available to our students, and we do it at a reasonable price. And then on top of that, 100% of our students have received, some form of financial aid to date. So wherever we can support students, we look to support students. We really don't want finances to be a reason that somebody can't earn their MD.
Great, thank you. And that seems to be it for questions. If you have any more questions, please drop them in the chat. If not, does anybody else Ben. So we have somebody having the interview tomorrow, actually. So congratulations, Ben. We all wish you the best of luck. I'm sure you're going to do excellent.
I'm excited for you too, Ben. Good luck tomorrow with Dr. Blasky. Yeah.
Would anybody else on the panel like to touch on any other topic or, say any final words to those joining us at the webinar?
Well, I'd just like to say, whoever's on the webinar that's already applied, best of luck in the process. And if you're successful, we look forward to welcoming you on campus in August, if not January. And if you haven't applied yet, I hope what you've heard on this webinar, as well as the recordings of the previous webinars, which are available on our website, will help you make the decision to apply to ACSOM.
Great. Wonderful. Thank you, everybody. So I do want to reiterate what Dr. White just said. We invite you, we welcome you to submit your application. Once again, grab your phone, grab this QR code, submit your application as soon as this webinar ends. Again, you don't need your official transcripts, you don't need your letters of recommendation, but let's start the process. If you're ready to start in August, we can expedite your application as well, but you do need to submit that tonight or tomorrow so we can make that happen. Again, do not hesitate to contact me with any questions. I did put in my email address and I can drop my telephone number in a moment so you can reach out to me with any questions. But on behalf of the entire ACSOM team and the entire panel here today, we thank you so much for joining us. We wish everybody the best of luck, whether you have applied already or have not. We hope to see you soon on campus. Wishing you all the best. Have a great evening.
Have a good evening.
Thank you, Maria.